Introduction. Welcome, medical students, to today's lecture on laryngitis. In this comprehensive script, we will delve into the intricacies of laryngitis, exploring its infectious and non-infectious causes, pathophysiology, differential diagnosis, treatment options, surgical interventions, impact on different populations, imaging modalities, and its overall impact on patients' quality of life. By the end of this lecture, you will have a thorough understanding of laryngitis, enabling you to diagnose, manage, and educate patients effectively. So without further ado, let's embark on this enlightening journey through the world of laryngitis. Laryngitis can be caused by viruses, for example, rhinovirus, influenza, bacteria, for example, Streptococcus pneumoniae, Haemophilus influenza, or fungi, for example, Candida. The infection leads to inflammation, resulting in symptoms like hoarseness, sore throat, and cough. Severe cases can cause difficulty swallowing or breathing. Non-infectious factors like smoking, allergies, and vocal abuse can cause laryngitis. Smoking damages the larynx, allergies trigger inflammation, and vocal abuse strains the vocal cords. All these factors lead to tissue damage and inflammation in the larynx. In acute laryngitis, rapid inflammation occurs in the laryngeal mucosa. This is caused by immune cells like neutrophils and lymphocytes. Symptoms include hoarseness, dysphonia, and throat discomfort due to mucosal edema and increased vascular permeability. Vocal cord swelling and erythema impair vibration, resulting in altered voice quality. Vocal rest and appropriate treatment can reverse these changes. Chronic laryngitis is a persistent condition caused by repeated episodes of acute laryngitis or prolonged exposure to irritants. It leads to structural changes in the laryngeal mucosa, causing hoarseness, reduced vocal range, and vocal fatigue. Severe cases can result in complications like vocal cord nodules, polyps, or laryngeal stenosis, leading to impaired vocal function and reduced quality of life. Differentiating laryngitis from other related conditions is crucial for accurate diagnosis and appropriate management. Pharyngitis, for example, presents with similar symptoms but primarily affects the pharynx rather than the larynx. Distinguishing features may include the presence of tonsillar exudates in pharyngitis and specific vocal changes in laryngitis. Laryngopharyngeal reflux, LPR, can also mimic laryngitis. Both conditions share symptoms such as hoarseness and throat discomfort. However, LPR is typically associated with gastrointestinal symptoms like acid regurgitation and heartburn. Indirect laryngoscopy or laryngeal biopsy may be required to confirm the diagnosis in certain cases. Vocal hygiene plays a vital role in the prevention and management of laryngitis. Patients should be advised to practice voice rest, especially during acute episodes or when symptoms worsen. Adequate hydration is also essential to maintain optimal vocal cord function and prevent drying of the mucosa. Furthermore, patients should avoid irritants such as tobacco smoke, alcohol, caffeine, and excessive vocal use. Educating patients on proper breathing techniques and voice projection can minimize strain on the vocal cords and promote vocal health. In the treatment of laryngitis, medications like analgesics, anti-inflammatory drugs, and antifungal medications can be used. These medications have different mechanisms of action and potential side effects that need to be considered for effective treatment. It is important to assess patients individually and monitor them closely for optimal outcomes. Voice therapy plays a pivotal role in the comprehensive management of laryngitis. Through targeted exercises and techniques, voice therapists aim to reduce vocal strain, improve vocal cord coordination, and restore optimal vocal function. This may involve methods such as vocal warm-ups, airflow control exercises, and vocal cord relaxation techniques. Voice therapy also addresses behavioral modifications, such as avoiding voice misuse and adopting optimal speaking and singing techniques. The incorporation of voice therapy in the rehabilitation process enhances treatment outcomes and promotes long-term vocal health. In certain cases, laryngitis can lead to complications that require surgical intervention. These complications include vocal cord nodules, polyps, or laryngeal stenosis. Surgical options may include vocal cord microsurgery, laser therapy, or laryngeal reconstruction. The decision to pursue surgery is based on the severity, duration, and impact of the complications on the patient's quality of life and vocal function. The surgical outcomes vary depending on the specific procedure and the individual's response to the intervention. Diagnosing and managing laryngitis in special populations, such as children and the elderly, requires consideration of age-related factors, comorbidities, and occupational demands. Tailored treatments and interventions can improve outcomes for these vulnerable groups. Accurate diagnosis of laryngitis often requires imaging modalities to visualize the larynx and assess its structural and functional changes. Laryngoscopy, both indirect and direct, is a valuable tool in evaluating laryngeal mucosal inflammation, vocal cord mobility, and the presence of any structural abnormalities. Laryngeal biopsy may be necessary in cases where a definitive diagnosis cannot be made based on clinical presentation and endoscopic findings alone. The histological evaluation of biopsy specimens assists in identifying specific etiologies and ruling out more serious conditions. Laryngitis can have far-reaching consequences on patients' quality of life and vocal function. Not only do the physical symptoms of hoarseness and discomfort impact daily activities and communication, but the psychological and social ramifications should not be overlooked. Individuals with laryngitis may experience decreased self-esteem, anxiety, and depression due to compromised vocal performance. This further emphasizes the importance of timely intervention, proper management, and rehabilitation to address not only the physical aspects of the disease but also the psychosocial implications. In conclusion, laryngitis is a multifaceted condition that requires a comprehensive understanding for effective management. Medical students need to consider medical interventions, vocal hygiene, and potential surgical and voice therapy options to enhance patients' well-being.